Chris with Rowe Dental Laboratory. Here at Rowe, we offer a variety of options for your full arch finals, and I'm going to cover a few of those in this video. But before I go into those options, I want to cover some general points to keep in mind no matter what option you go with. First, and probably the most important, is that we need 10 to 15 millimeters of restorative space. We have some great warranties with all of our finals, but to take advantage of a full warranty, we have to have a minimum of 10 millimeters, ideally up to 15 millimeters of restorative space. Next, no matter what option you go with, they can be milled direct to multi-unit abutment. So it'll work with your photogrammetry or grammetry workflow. And it also doesn't matter what implant system we can mill to that platform. We can also incorporate traditional copings in the final if you want to go with an analog workflow with models. We can add a metal substructure to each one of these options. And then finally, we can also incorporate our Passivity Plus copings in any of these options. Now, the Passivity Plus coping works with your digital or analog workflow, and specifically with digital, you don't have to change a thing. We don't need any additional records, and we can cement the Passivity Plus coping in your final. The way those work is it adds an increased level of passivity across the arch. So as you screw down your prosthesis, the Passivity Plus coping self-adjusts onto the multi-unit abutment. Again, adding that additional level of passivity no matter what workflow you use. So let's go into some of the options here. The first is going to be our Monolithic Zirconia option. That's the strongest and most aesthetic option you can go with when it comes to fixed full arch. Another option is our Graphenano G-CAM. This offers a lightweight aesthetic, nano-reinforced alternative to zirconia. So this is not as strong of a material. It's still a milled prosthesis. It is kinder to the opposing dentition and is highly aesthetic as well. So this would kind of be used for those patients, maybe they don't necessarily need zirconia, or maybe they're opposing a denture or whatever the situation might be where you don't want something as strong as zirconia. The G-CAM is a great option. Or perhaps this could be used for that patient that maybe just can't afford that zirconia, but you want to get him into a fixed full arch final. Our third option is our Ivoclar's Ivotion milled puck. This is a digitally designed, digitally milled option that utilizes a fully integrated teeth and base all in the same puck. The teeth are scalloped within the design of the puck itself. So again, very strong, highly aesthetic option. And this could be a long-term temp. Could be for those patients, again, that just can't really afford the zirconia option, something to get them into while waiting to maybe save up for that zirconia. So we have a few different options here on your full arch finals. One last thing to cover is our Bespoke upgrade. So you can upgrade your prosthesis for those patients that they're really conscious about the aesthetics and they really want to be involved in choosing and designing their full arch final. We have a Bespoke upgrade where you can work hand in hand with our designers every step of the way. The patient can pick up to 40 different customizable options in their final as well. So they can really feel like they're a part of the process of making the choice with you. And as I mentioned, we're going to work with you from every step from design to after milling to finishing the prosthesis. We'll send photos back and forth and really make sure that we're meeting the patient's expectations on their final prosthesis. If you have any questions, please give us a call here at Rowe Dental Lab. You can also check out these options on our website, and we can't wait to work with you on your next full arch final. Thank you.